Hi, my name is Melissa, and my speech is on effective communication in nursing. The field of nursing is considered a calling, something that not everyone can do. When people think of this statement, they think of blood, guts, and anything nasty. But when it is all said and done, I think they are referring to the other side of nursing, the dealing with the patient, talking to the family when they are concerned about what is happening to their loved one, and even consoling a patient who is dying. Being able to effectively communicate with different people as a nurse is very necessary. What it means to be a nurse. Nursing has different meanings to different people. For some people, being a nurse means the chance to help others and to help other people make a difference. For others, nursing is just a job, a title, or a way to have a better life. Being a nurse is taking care of a patient that needs you during their very hard time in their life when they are sick or have to rely on you for their care. While figuring out what is wrong with them falls mostly on the doctors and for the doctors to figure out what medications or what's necessary for the patient, a nurse is the one who is by the bedside administering the medicine and figuring out if the patient is doing okay. Despite the wide agreement about the importance of effective communication in nursing, there is continual evidence of the needs of nurses to improve their communication skills. This was a quote from an article by a nurse named McCarthy, who's very big into nursing and just wants nurses to get out there and really get better at being able to communicate with people. Proper communication is the ability to clearly make your point understood to those you are addressing. Nurses and doctors undertake distinct preparation for clinical practice, but are expected to communicate effectively in the workplace. And if they do not communicate effectively, patient care is poor, which can and has a direct correlation on patient outcome. This came from an article by another nurse named Nurse Curtis, who was concerned that nurses talking to doctors, the communication, there was a slight barrier there, and nurses were not being able to communicate effectively to doctors what needs to be done. With communication, there is a need for planning. You should be able to know what you're going to say, how you're going to say it, and effectively say it in a way that will come across to the patient in a way that they can understand. It shouldn't matter whether you're talking to the patient themselves or if you're talking to a family member. They should be able to understand what you're trying to say and how you're saying it. Okay. There is much about nursing that is communication based. Speaking to doctors, speaking to other healthcare professionals, speaking with other nurses, and one of the most important parts is speaking with the patient. I need to risk communication in whatever way I can because communication is the road to healing. This was a quote by Leanne Mercer, who is also a very talented nurse in the field, and she wanted this was a quote she got from an article I got from an article that I read of hers, that she after speaking with a patient, the patient had said the best part about her as a nurse was that they could communicate to one another and that she as a nurse could understand where the patient was coming from. As a nurse, I will need to be able to communicate with patients so that they know and understand what I'm saying and how I'm trying to help them. Because if they can't understand what's being done, it makes it a lot harder for medical staff in general to do their job. Everyone has their own opinion about different things, but unless the patient is asking you, then you don't want to give information in the wrong tone, or it can be taken the wrong way. So that just goes back to just needing to know how to communicate with the patient and with the staff, and making sure that the patient is comfortable with what's going on. In conclusion, communication is a key component of nursing. The ability to effectively communicate with the staff, medical staff, doctors, and especially the patients is a key part of the job. Sometimes the hardest news a nurse will ever have to do, or the hardest part about the job, will be talking to a patient. Effective communication can be your best weapon. If you can effectively communicate, then you can get the point across. Then as a nurse, people will always understand what needs to be done. That was my speech on effective communication as a nurse. I hope you enjoy. Thank you.